Down syndrome trisomy 21 second part. If you have missed the first part, then you can check it from the given link in the description of this video. As we learned from Dr. Nishi in the first part, the children with Down syndrome have their own development curve, which you can see online. Let's see what Dr. Nishi Bhatt is sharing about other problems caused by Down syndrome trisomy 21.
You might find that they might develop certain speech delays, motor skills delays. Yes, there is a general development delay that you will find in the children. Now, when we're talking about systematic features in the child, you'd find that they have issues with digestion. So we call that as duodenal atresia. It's kind of like a small bowel that does not develop properly. So there's a stomach and then there's a little kind of like area which is not developed. So when they're not able to eat properly, so you would find in the earlier stage they may have vomiting issues, very low birth weight, swelling in the upper abdomen. There is also issues with indigestion, refluxes. There is also constipation issues. So when we see those kind of things, is you kind of come to know that it is a Down syndrome child when they check. There are also other issues when it comes down to cardiac health. They do have congenital heart disease, which also is, there's also hypothyroidism that you might find in some of the children. With Aalok case, that was also present. So certain features that you might see is, like the pale skin, sleeping longer. They may have constipation all the time, and also a very large spot on the head, which is like a soft spot, which was present in Aalok as well. And also the swollen tongue. So the tongue is swollen. You will also find there's a weak floppy muscles in the body, swelling around the eyes. You'll find poor and very slow growth altogether, which was also present in Aalok. You'll find cool and pale skin on the face, general pale skin, and very large belly with kind of navel which is protruding outside. So these are kind of like hypothyroidism cases as a child. And there is also hearing loss and also the vision issues that you might find with your child. There is eye diseases, increased risk of celiac diseases. Again, there is instability of a lot of things that you might find. There is poor balance. Intellectual disabilities are always present, but there is also very increased risk of leukemia, and that you have to look out for. And these are normally found with the children with Down syndrome more often than the others. So when you're looking for the signs of leukemia in your child, you have to see, does your child have pale skin? Are they feeling tired all the time? Are they always feeling weak or cold? Can you see dizziness, headaches? Is there a shortness of breath that you can see that the child is facing? Also, is there frequent kind of infections that they are facing? There's fever, easily they are bruised in their arms. There's also the bleeding in the gum. Is there a bone and a joint pain that they're facing? Is there a swelling in the stomach? Is their appetite really poor? Are they losing weight? And also the swollen lymph nodes. These are one of the things that you should always look out for if you have a child who is suffering from Down syndrome. So these are the things that we also saw in Aalok when they came to us. And normally the patient's parents are not able to define all these problems. So when they visit us at the clinic, we are able to diagnose all that, and then we work on various levels. of resolving the characterization features that are already present, but also we try to get the clinical features which are present. We try to reduce those symptoms in the child, so we can see development growth in the body, the joint growth, and also intellectual growth that we can see. The cognitive development is also seen in that.
So, these are the problems that can occur in the child with Down syndrome, and it is very important to diagnose all the symptoms closely for its perfect treatment. In the next part of this video, we will see when and what changes came in Aalok after Dr. Nishi Bhatt started treatment. Dr. Nishi Bhatt is the founder of Naadi Yoga and psychoneurological and pain management specialist. Dr. Nishi Bhatt has expertise in the cases of special need kids. She does not use any single therapy, but uses different therapies like Alexander techniques, Bourne techniques, craniosacral therapy, Feldenkrais therapy, Rolfing therapy, among many others for the treatment according to each case, due to which these children start getting very good result in a very short time, which does not come even after years of doing other treatments. Now, along with India, patients from UK, USA and Canada can also take treatment from Dr. Nishi Bhatt in their own country. Dr. Nishi will be visiting India in September. Take this opportunity to change your child's lives. For treatment or consultation, book an appointment in advance on the given helpline number. Naadi Yoga, opposite Pacific Gulf State, Sahasradhara Road, Kulhan, Dehradun. Visit our site www.naadiyoga.com and mail your inquiries at naadiyoga@gmail.com or call on landline 135 262 9944, mobile 72520 52999.